Okay, my name is Jae-Won Shin, and I am an associate professor in pharmacology and biomedical engineering. And Dr. Katani emphasized the importance of the interface between medicine and engineering, and that's exactly how the BME department was formed some time ago. And our laboratory, in fact, is located in the College of Medicine. And this this interface has played an extremely important role for our lab's work. We're leveraging multidisciplinary approaches in order to solve one of the most challenging problems in biomedicine right now, which is how to regenerate tissues. A lot of times in the chronically damaged tissues, such as even for some patients who suffer from COVID, skin, people who suffer from immune disorders, scarring, and even liver, you see that the tissues become fibrotic, where their functions are compromised. And in fact, about 45% of all deaths are associated with severe fibrosis in the developed world. So our laboratory is trying to think about some of the fundamental strategies or processes, or try to understand the fundamental processes that lead to the sculpting these already damaged tissues into normal ones. So how do we go about doing that? Generally, there are two important things to do. The first important thing is, let's say that tissues are damaged. One way that we have to think about is how we can go about getting the cells coming from donors, and then how to effectively control them or program them in order to lead to the regeneration. So that's the first part, which is in order to modulate donor cells. But the second way, which is actually a more important part, is to be able to regenerate or reset the host tissues that are already damaged, including the cellular components such as immune cells, but also non-cellular components such as the extracellular matrix that forms the tissues. So in order to solve this problem, we're tackling this approach by essentially combining the biomaterial design with micro technologies such as droplet microfluidics and also printing as a means to develop the micro-engineered environments in order to control individual cells and interrogate their functions so that we can identify the best condition for them to become regenerative. In addition to that, we're trying to understand, by interfacing between cells and biomaterials in this engineered environment that are inspired by the physiological tissues, we're trying to understand how we can go about regenerating the host tissues that are damaged. So these are some of the work that came out since the beginning of our laboratory, which we started about 6 years ago. And really, our laboratory is highly diverse, coming from different backgrounds. We hang out from time to time, across different locations. I just wanted to highlight also some of the alumni that came out of the laboratory, who really played an instrumental role when the lab started out, including Dr. Seung-Wan Wong, who is now who was a postdoctoral fellow in the lab, and he's now has his own laboratory in the Colorado State University, and Dr. Stephen Lenzini, who is a former BME graduate from UIC, and he's now at Rooster Bio as a scientist. And we are funded by multiple sources from NIH and NSF. So if there is any question, feel free to reach out to me. This is my email address, and thank you.
Thank you, Jay.